Mr. Chevy Chase is better known to all of us for the laughter we have shared around his Emmy Award-winning work on Saturday Night Live, the multiple National Lampoon movies, and other movies such as Caddyshack, which is certainly a classic for all of us. Although his work as an actor continues, he and his wife established the Center for Environmental Education online foundation with several core missions, including getting healthy foods into schools.
Thank you for the opportunity to testify before your subcommittee. My name is Chevy Chase. In addition to my work as an actor, I also have worked along with my wife, Janie, sitting behind me, to improve children's health. Together, we founded the Center for Environmental Education, a resource for educators and students on health, environmental, and nutritional issues. School nutrition is one of 3 priority areas of our center. As you know, rates of obesity among U.S. children and teens tripled between 1980 and 2002. Of the children born in 2000, almost 40% of girls and 1/3 of boys are on track to develop diet-related diabetes during their life period. This is no laughing matter. For the first time in history, our nation's children have a shorter life expectancy than their parents. With the growing concern about childhood obesity, many schools are realizing how important it is for children to have access to healthy foods. Vending machines and processed meals are being replaced with fresh, healthy food that is also serving as a central part of student learning each day. Janie and I applaud school districts' efforts to implement strong school wellness plans during this past school year. These plans support parents' ability to feed their children a healthy diet. Parents should not have to worry that their children will spend their lunch money on low-nutrition foods from vending machines. It is time to return parental control of their children's diets to parents, and that means setting strong nutrition standards for schools. Nationally, more than 80% of schools at all grade levels sell foods and beverages out of vending machines, school stores, or a la carte in the cafeteria. Unfortunately, too many of the choices offered to the children are chips, candy, cookies, sugary beverages, and other foods of poor nutritional value. Too many children are building lunches out of cookies and French fries, which is contributing to the nation's obesity epidemic. I'm surprised to learn that the U.S. Department of Agriculture nutrition standards for foods sold in cafeteria snack lines were set in the 1970s and have never been updated. USDA's current standards allow the sale of donuts and ice cream, but prohibit the sale of seltzer water and breath mints. This standard doesn't make a lot of sense. Although given the choice, I'd go for a newspaper sandwich and a glass of smoke. It's outrageous. Outside of the cafeteria, no nutrition standards are in place for foods sold through vending machines and school stores. Congress needs to call on the USDA to update its outdated standards and apply them to the whole campus and to the whole school during the whole school day. Janie and I strongly support Representatives Woolsey's and Shea's Child Nutrition Promotion and School Lunch Protection Act, H.R. 1363, which we urge Congress to pass this year. While some might say that school nutrition should be solely addressed at the local level, since the Truman administration, the school meal programs have been federal programs. The federal government invested $10 billion in fiscal year 2006 in school lunches and breakfasts. Selling chips, candy, and sugary drinks in schools undermines that taxpayer investment. Last year, the Alliance for a Healthier Generation, the nation's largest soft drink companies, and several snack food companies announced voluntary guidelines for nutrition standards for foods and beverages sold in stores. While their efforts are laudable, these voluntary guidelines are unenforceable, and it remains to be seen whether and to what extent schools will accept and comply with them. Child nutrition is too important to leave to chance and voluntary efforts. As the USDA and Centers for Disease Control and Prevention documented in their report Making It Happen, students will buy and consume healthy beverages, and schools can make money from selling healthy options. Of 17 schools and school districts they surveyed, that tracked income after switching to healthier options. 12 increased revenue, and 4 reported no change. The one school district that did lose revenue in the short term experienced a subsequent revenue increase after the study was completed. School beverage vending contracts raise only a comparatively small amount of funds. District contract revenues amount to less than 0.5% of annual district per student spending. Moreover, the money generated from school vending contracts comes from the pockets of students and their parents. Though vending contracts, soft drink companies through vending contracts, soft drink companies gain exclusive advertising rights to promote and increase the sale of products in schools. In closing, Janie and I would like to encourage school districts across the country to continue to strengthen their wellness plans. In addition, we urge Congress to strengthen the national nutrition standards for foods and beverages sold out of vending machines, school stores, and a la carte in schools by passing Representative Woolsey's bill. The health crisis posed by the childhood obesity epidemic deserves all of our best efforts and attention. Again, I thank you.